The clinic was set up as a collaboration between both CCLHD and Royal North Shore Hospital, where normally our Central Coast patients would go to Royal North Shore to be seen for their spinal pain. We came up with an idea to put a satellite clinic here at Gosford Hospital so that they then could access it closer to home. And what happens is a physiotherapist actually sees the patients before a surgeon and tries to prevent them from having surgery.
We were able to offer early intervention, and because of that, over 70% of the patients we saw no longer needed to see a surgeon. The benefits to patients were that they no longer had to commute down to Royal North Shore Hospital to receive this service. So often the patients weren't actually turning up to engage with the service because it was such a long commute time, and given they had severe lower back pain or neck pain, it was resulting in increased pain and dysfunction for them. There was also a reduction in travel time for the patient, over 5.25 hours per patient per encounter. The other great outcome was that we were able to reduce carbon emissions and reduce our carbon footprint. So we saved over 3,024 kilograms of carbon over the year.
This came from a net zero initiative and a project that was just funded for a short period of time. The fact that we've been able to show such great outcomes for our patients and get this permanently funded within our district, I think is the greatest achievement.
Last year, two of my colleagues and myself embarked on a clinical redesign project to look at how we could use some vacant allied health positions that we had to best meet the needs of our adult mental health consumers in the community. What we were able to identify is that there is a missing middle. So what we've found is that because of increased demand for our mental health services within the public health system, it means that there's prioritisation of those with the most complex needs. And what that then means is there's a gap for those people who are needing to access services, but their needs aren't seen as severe enough to access public mental health services, but they're often too complex for the primary care providers.
The biggest outcome, I guess, has been the BIMS team, which is the Brief Intervention Mental Health Service. We have 6 senior clinical positions there, so that's social work, occupational therapy and clinical psychology. And our service has already been seeing a lot of people since January this year. And we've really been providing intervention, evidence-based mental health intervention to people when they're really in a period of acute psychosocial mental health crisis. So the best outcome, I guess, has been that that team has evolved at the other end and developed to a point where we're now getting consistent referrals and able to service those people and provide a service that the project showed was really needed.
Really proud of the fact that we were able to really engage so many stakeholders in the development of this service. We were able to include the voice of our consumers and carers as well. And I think that's been a really big part of the success of this project.
We know that we've got a small but growing multicultural community on the coast, and we also know that during the pandemic, for example, multicultural communities were less able to access information about the pandemic and also had multiple barriers to accessing vaccination on top of health literacy concerns. So the IVAC program, which stands for Increasing Vaccination Access for Cold Communities on the Central Coast, was really aimed at trying to address some of these barriers with both education and combining that with bringing on-site vaccination to participants.
Locally, we have an adult migrant English program at TAFE, both at the Gosford campus and the Wyong campus. There's about 200 students a year that attend that particular program. Leveraging off our partnerships with TAFE, what we did was actually go in and have education first with the students. After that education, we were able to run outreach vaccination clinics on site. So not only providing that information for people, but then having that opportunity after education to have the vaccine.
The response to IVAC has just been overwhelming. During the pilot program, we were able to run 15 education sessions, which reached over 300 participants from more than 21 language groups. And through the clinics, we were also able to deliver 271 vaccinations, which included predominantly COVID and influenza, but also a range of other catch-up vaccinations for people as they were eligible. We've certainly seen from the response this year following the pilot program that there's been even more uptake and even more interest in joining this program this year. So we're just thrilled to see where this will all lead.